I got super aggressive, then started having suicidal thoughts and just wasn't myself anymore.
The number of German children and adolescents with mental health issues has been rising for years, but access to therapy is spotty at best.
Then you get told you have to wait. You won't be treated. It's extremely distressing.
Some people have to wait years to receive therapy, and due to cuts in healthcare funding, the situation could get worse. Is Germany's mental health being sacrificed to balance the budget? Marie's mental well-being deteriorated rapidly during the COVID pandemic when she was 12 years old. Today, Marie, who's from near Cologne, knows she has ADHD.
It got to a point where it was so bad I was having really intense rage attacks and constantly threatening to take my own life.
She had to wait 3 months until she finally received treatment at a clinic.
That was a difficult time for us too. We were very happy when she finally started therapy.
After treatment at the clinic, Marie had to wait another 5 months for regular therapy appointments. And though she considers herself lucky, she still found it hard to get through that time.
I had my support railing and then lost it and had to keep going on my own. That was really hard.
Child and adolescent therapist Silvia Goeres is furious. Every week she has to turn away several, often desperate parents, and she's already working more hours than she gets paid for. The current waiting time to become a new patient at her office is just under 1 year. And at the offices of some of her colleagues, it can be up to 3.
It's really absurd. Imagine if it was like this in somatic medicine. You come in with a child that has a physical health problem, urgent, maybe even life-threatening, and then you get told you have to wait. You won't be treated. It's extremely distressing, and it's gotten worse.
Health issues can get worse when left untreated, and mental illnesses can become entrenched, with potentially fatal consequences, warns Goeres.
What can happen is actually the most serious issue, an increase in suicides among children and adolescents.
Suicide is already one of the leading causes of death among children and adolescents in Germany. And it looks like this dire situation could soon get worse. Since April, public insurance reimbursements for therapy have been cut by 4.5%. Many fear that in the future, the cuts could lead to therapists having to further restrict the number of sessions they offer through the public health system. Demonstrations have been taking place across Germany for weeks. Silvia Goeres says the public needs to learn more about the worrying situation.
The discontent, the anger over this is enormous. I've never seen our profession speak out so loudly. We are here, we are loud, because you're killing therapy.
We're in a state of emergency, and these fee cuts are the last straw.
We therapists won't just let this happen. We're fighting for quality mental health care.
Instead of cuts, we need investment in psychotherapy and people's mental health.
The public insurance providers responsible for the cuts declined to give an interview to DW. But they emphasize that they do not expect a deterioration in offerings and claim that by international standards, quality of care remains very high. But following a reform in psychotherapist training, it's currently unclear who is responsible for funding the mandatory advanced training after graduation. This has resulted in a shortage of training spots, and many graduates cannot advance despite having a degree.
Overall, and that includes our class of students too, there's a lot of frustration with the way the system is right now. There is still no guaranteed training spots. So it's not clear to us whether we'll ever be able to offer outpatient psychotherapy at all, or how long it would take to get there. There's simply a lack of funding. More and more obstacles are being put in our path.
So what's the government doing to improve the situation? The Ministry of Health responded to our inquiry in writing, saying, Ensuring needs-based and timely therapy options remains an important health policy concern. The care situation is being kept under observation. The ministry now aims to create additional treatment capacity in the child and youth care sector to reduce waiting times. For Goethes, these improvements are long overdue.
I'm very frustrated and hope that policymakers will make better decisions in the future. I want them to support this profession, which is important and systemically relevant, instead of undermining its funding.
Dort gespart.